All right. Well, good afternoon, everybody. I'm Greg Fischer, the mayor of Louisville. Thank you for joining our daily COVID-19 media briefing. And as we celebrate another beautiful spring day here that everybody wants to get out in and get some good fresh air from appropriate social distance, please get out and take a deep breath. One of the feedbacks we're getting throughout all these sessions is people didn't realize how much different kind of work local government does. So I think people now really are starting to understand the role of the public health department and how public health is out there waiting for emergencies, preparing for emergencies, never knowing if they're going to come. Well, I think it's safe to say one has certainly come now, and people really are appreciating the work of our public health department. And this just happens to be Public Health Week, appropriately timed here in the United States right now. So I wanted to give a big shout out to the 200 or so folks that we have in our public health department, led by Dr. Sarah Moyer here and Dr. Lori Kaloya. They have become familiar faces to the community now as a result of this COVID outbreak, and they, like the rest of their team, are working tirelessly. We come off a good foundation. You'll remember when we had the hepatitis A crisis in the community not too long ago. And a lot of communities really struggled with that. Louisville's health department was given a gold rating by the Center for Disease Control, saying we were amongst best in country for dealing with that. So we got a good team. We're applying all of their knowledge and discipline to COVID-19 as we work through this. So I just want to thank our team for working incredible hours, incredible dedication to keeping our citizens safe, and you can't have much more of a noble goal than that. So big shout out to our whole public health and wellness team. Thank you all. All right, let's take a look at some of the data now. The public health team, amongst every other thing that they do, also studies and reports the data here with our COVID-19 virus. So I've got some new data today that media has been very focused on. So we'll start reporting on this on a daily basis. So I want to give you some of our first responder data. So this is our police department, our fire department, our corrections department, our EMS department. Total numbers off due to COVID-19 on April 6th are 44. We have 4 that are off with positive tests. As I've said earlier, 3 of those are LMPD, and 1 of them is a corrections officer. 22 are off and quarantined due to exposure to someone with a positive test. That could be either exposure on the job or off the job. So most of these have been off the job. And then 18 are screened off with symptoms and tested or due to be tested, but they haven't received their test results back yet. So we keep them screened off. Relative to the jail, here's what I can tell you on that. As of April 3rd, a couple of days ago, 29 inmates have been tested, 26 are negative, and 3 are pending. And then we have 4 inmates in isolation. All right, so I hope that information is helpful to everybody. On the broader community, we expect these numbers to keep going up, and they are. We're doing more testing, so you're going to see more and more positives. We have 372 confirmed COVID-19 cases now. It's our biggest single day increase, an increase of 59 over yesterday. So again, we're going to continue to expect to see that go up. Now, sadly, as each one of these days goes on, we're going to lose more and more of our friends and families and neighbors. We learned that 3 additional people have died from COVID-19. So that brings us to a total of 23 folks that have passed away from the COVID-19 virus here in our community. We have to brace ourselves for more in the community. Nationally now, we're over 10,000 people, and this is going to be a really difficult week. And next week in America for the number of deaths from COVID. So just know that's coming. It's not going to make it any less sad, but that's what the status of the disease is right now. So it's peaking in some of our big cities. It's not peaked here, so don't think that we're just because we don't have massive numbers dying that somehow we're going to get off from this. That's what we're working to avoid. So just please keep all of these folks in your prayers. And funerals are an important part of the tradition that we have as people, and being able to mourn together and cry together and hug on each other to get us through these times. And that's what makes it additionally tough for our families and friends that are passing away right now. just don't have those rituals. And some of the folks, obviously, they're dying in the hospital, and we can't even go visit them and give our last words and hugs and kisses. So it's tough in normal times. It's really tough right now. So if you know anybody that's been affected by this, please reach out to them and give them your virtual love and thoughts as we all get through this together. It's just really hard. We all know that. So we got to ask ourselves, what can you do to slow it down? Because the virus doesn't move by itself, as Dr. Moyer says, it moves between people. So we can slow the spread of the disease, and we've been doing a relatively good job of that here in our community. I'm proud of that. So to prevent more deaths and reduce the pain and the loss that this virus has spread throughout the world, you can probably repeat it with me right now. What would you expect me to say? 2 words, right? Stay home, stay home, stay home as much as possible. And if you have to leave the house, remember, keep 6 feet between you, that's social distancing, and everybody else. And now, if you leave, just like you saw in that picture that was up a moment ago, if you got to go out to a store or we know a large number of people are going to be, make sure to put on a face covering, put on a mask or something else that you make. That's a new guideline from the Center for Disease Control, and it will help other people so that you don't breathe on them or sneeze on them or cough on them and vice versa. Now, we do not want people thinking that if they put on a face cover that all of a sudden now they can get closer to people. That does not mean that at all. This is just an additional level of protection that you're taking for yourself and for the community. Okay, so everybody, I threw my face mask on yesterday. So get used to a look like this. Get your own face mask. You can make one if you don't have one. And this is how we're going to be looking at each other for a while right now. Okay, so this is a new look. This is a new look where you're taking care of yourself and others as well. So please remember, we're doing all these things so we can continue to keep the number of people who die from this disease as low as possible. And for those folks that are passing away, we're going to continue to have Metro Hall, City Hall, Big Four Bridge lit up in green. Green is the color of compassion. And if you can add a little green to what you're doing on your lights, please do so, as well as we remember all these folks that we've loved and they've passed. Now, a new report from the U.S. Department of Health and Human Services that just came out today reiterated the concerns we've been hearing that nationwide, our hospitals need more staff. You've been hearing that from Governor Cuomo in New York, who he's asked folks from around the country to come and help them out, and some have responded to that. Hospitals need more staff, they need more supplies, more equipment to respond to all these COVID-19 patients coming into our hospitals. In Louisville, it's our incident management team that reports right now our hospitals are not seeing these issues where we have lack of staff, and we're pretty well situated for the time being. But we are preparing for when this hits and make sure that if it hits us, we don't have these same kind of challenges we're seeing in New York and Detroit and New Orleans, where they're being overrun by folks that need health care. So that's why on beautiful days like today and like we're expecting this week, even though it's okay and it's good to go outside, you can do that as long as you remember, say, what am I doing to deny the virus? How am I beating the virus? You're doing it by keeping your distance, wearing your mask, no matter where you're at. If you're on a park, if you're on the Big Four Bridge, if you're on a golf course, keep your distance, wash your hands, all those things. Now, I want to again say thank you. This weekend, I went on a couple long bike rides to get out and about, put a helmet on, sunglasses on, and cruise around the city. And I was really, really gratified that the people of Louisville listened to all of our cries to keep social distancing. So while there were a lot of people in the parks, they were spread apart. They were keeping proper social distancing for the most part, probably 99% or so. So it really, people are listening and they're helping, almost everybody. Okay, so I want to say I'm very proud of our city. I'm grateful that everybody is heeding the call. Let's continue to reinforce with each other that this is the appropriate and responsible thing to do. Okay, we need to lean on each other, and we got to stay the course here. We still have some time before we get through this thing, so we can't get weak right now because it just takes one massive spreader for this thing to really get out of control. And I'm worried about that because while the vast majority have been behaving in a good way, here's what we're seeing too many of. We are still seeing too many people throwing house parties. Okay. So think to yourself, okay, we're in this public health crisis and you want to throw a party? Come on. That is not smart. And you might say, well, these are my friends. I know them. They're good. Remember that this disease is being spread by people that have no symptoms. Okay, they're asymptomatic. So you don't know if they have them or not. So you should be thinking everybody has the virus and modify your behavior accordingly. And then the virus will go away if we do that. So these house parties, we're not getting noise complaints about. It's just that we can't have this now. Okay, it's not smart. And I understand that people might say, let's give this a little break. We can trust these folks. It's not about trusting anybody because you don't know what their health condition is. But what you're doing is you're risking the lives of your friends and your family. And then if they get spread at your party, they're going back out into the community as well. So please, everybody, it is not worth it. And if you've been paying attention to the media where they talk about how communities, the death forecast depends on if there's moderate social distancing or more extreme successful social distancing. You'll see how much lower the curves are when you have successful social distancing. That's what we're trying to do. So that means the difference in a lot of things we've been talking about, but one of them I can guarantee you is no house parties. Okay, so please, we need your help with that. We got Easter weekend coming up. We got Passover this week. We just cannot be getting together at this point in time because this virus is looking for those occasions. Get on us, make us sick, and worst cases, obviously kill us. So we need your help on that. All right. So this is everybody can make this choice. It's a smart choice. It's a compassionate choice. Please do it. Okay. All right. Speaking about compassion. I'm going to share all kinds of really great things that have happened this week, and we're not having to look for them because they're happening everywhere. So I want to again give a big shout out to our community. I want to thank the people and organizations that made the compassionate choice to support the One Louisville COVID-19 Response Fund. You remember we launched that on March 16th, and we have already raised over $8 million to support families and organizations that have been impacted by COVID-19. $8 million. Okay. That is incredible. The gifts have ranged from $10 to $1 million, and they keep coming in. So you can go to louisvilleky.gov and you'll see in the top left of the homepage there. You can click on there both to give and also if you need funding, it'll give you instructions on how to do that. But I mean, that's $8 million, 8 million reasons to smile. Okay. So just great work. I want to say thank you to everybody for really stepping up here. On the family side and individual side, over 3,000 households have set up appointments to apply for the One Louisville Fund. And so that fund will be covering basic needs like food, transportation, rental assistance, and more. And so we're working with everybody to get their appointments in place as quickly as we can. And in the meantime, to families worried about how they're going to pay their bills, specifically rent and housing expenses during this crisis, we are working to create an additional resource. So my team and I are working with the Metro Council to shift $500,000 currently budgeted for the Louisville Cares program. That's an affordable housing program. And instead put those dollars into the One Louisville Fund for COVID-19 relief and make them available for individuals who need immediate assistance with housing payments. So for background, this program we call CARES, not to be confused with the federal program, but Louisville Cares is also known as the Creating Affordable Residences for Economic Success program. And what it is, it's normally a loan program, but in these times, we want to strategically shift the funds to provide housing stability for families and individuals that are earning 50% or less of the area median income. So what that means for a family of four is if they earn $38,200 or less per year, you qualify for this program to help you with rental assistance. So we're making the connection with the One Louisville Fund So the CARES program will continue its mission to keep families and individuals securely housed. If you don't have secure housing, it is hard to live. So that's what the focus of this is. So even though evictions have been temporarily suspended, rent is still due, and the economic impact of COVID-19 is obviously creating lots of financial hardships that we have to find a way as a community to address. So families and individuals who qualify can receive up to $1,000 per household, and the CARES dollars would be designated for use for rent or utilities only. Okay? And the funds will be allocated through the neighborhood places with the current process that they're using for all of the One Louisville funds. And again, this is a proposal that I'm making to the Metro Council that we use the CARES funds to support individuals and families through One Louisville. And it's up to the council to approve this plan. And we're having very good conversations with them. And I'm quite optimistic that more help from the people of our city will be available soon. I want to thank our council too. We've really been working well together in terms of communicating what they're seeing in their districts, how we can immediately respond. So it's just been great teamwork. So shout out to our Metro Council. Thank you all. More good news related to our One Louisville COVID-19 Response Fund. Today, we're announcing a new round of awards to 15 local nonprofit organizations. We are blessed as a community with our nonprofits. I'll put ours up against any in the world. So today we're announcing a new round of awards to 15 local nonprofit organizations that do amazing work in our community. And you're seeing them on the screen here. American Red Cross, the Backside Learning Center, Bates Community Development Corporation, the Boys and Girls Club of Kentuckiana, Change Today, Change Tomorrow, Coalition for the Homeless, Elder Serve, Family Health Centers, Healing Place, Play Cousins, Society of St. Vincent de Paul, St. John Center, Up for Women, Water Step, and Wayside Christian Mission. These organizations do awesome work supporting some of our most vulnerable community members, and they've been great partners to our city for a really long time. I'm really grateful here to be joined by one of those great city partners, and that's Kristen Williams. She is the executive director of the Play Cousins Collective. Kristen, I want to thank you for joining us here today. And I'd like to ask you to pop up on the screen here so we can get a look at you and talk about the work that your organization does in our community.
Thank you so much. Can you all see me? Or can you?
I can hear you.
Okay. I hope that I can be seen.
There you go. All right, good.
Okay, great. Uh, we just want to say thank you so much, Mayor Fisher, and also thank you, of course, to the One Louisville Fund. Our organization, Play Cousins Collective, provides children's programming at community events, supportive learning and parenting circles, and mental health support for families. And so, of course, all of our gatherings have been canceled just to keep our families and communities safe.
And what kind of challenges have you been seeing here during this COVID-19 time?
So, from the family perspective, I think the largest challenge really is childcare. So many of our families are essential staff, but they are not medical staff. So they're still working in grocery centers, or they might be working at nursing homes or delivering products. And for those people, we cannot provide childcare, um, and so they have really tough decisions to make during this time.
So how's this grant going to help you guys?
So we're creating programming that we can take on virtually. We're also creating care packages for families. So tomorrow, for families who are working at home or just struggling to keep their children engaged, we every Tuesday at 10 a.m. have Black Book Joy. So we go live on our Facebook page and we read a book to the children and provide a craft and an activity, and also just some parenting tips and getting to connect with our families in a virtual way. So we're moving all of our programming online. We have mental health circles like Soul Sisters and Brother Healing Brother, and they're meeting virtually now as well. So we just had a meeting, and a lot of our families were expressing, the trauma that has taken place just trying to deal with this pandemic and what that means. And so being able to connect to one another has meant a lot. And then with the care packages, we're providing small amounts of food and like disaster kit type materials, flashlights, and things of that nature, just for people to be able to shelter at home and to feel secure, and really just to feel still connected to one another.
Well, you guys do amazing work and you provide a lot of comfort to people every day, but especially in times like this. So thanks for being there and being able to help more people in the community. We really appreciate you.
Thank you so much.
I'm just want to again say how glad I am about our One Louisville COVID-19 Response Fund being able to support our families in the community and our nonprofit sector as well. We've got a famous Louisvillian who wanted to weigh in on One Louisville a little bit, so I think we've got a little video that we're going to show here.
Hi, Louisville. Daryl Griffith. While you're at home practicing good social distancing, please consider going the extra mile and donate to the One Louisville COVID-19 Response Fund at louisvilleky.gov. Be safe.
Griff, Dr. Duncanstein speaks. If you can give to the One Louisville COVID-19 Relief Fund, if you're not going to give, I'm going to ask Daryl Griffith to dunk on you the next time I see you, okay? So you do not want him to get in your face because you will not recover from a Dr. Duncanstein dunk. So thanks, Daryl. You help the community in a lot of different ways. So everybody remember, go to louisvilleky.gov. That's your city's homepage. Top left, click there. You can donate. And if you need help, there's instructions on how to do both, okay? So everybody, thanks for stepping up. And I have to say, we talk about all the challenges that have come to us from COVID-19, but there's a lot of light in our community. There's a lot of hope in our community, and it's just people showing their compassionate hearts each and every day. And whether it's Daryl Griffith or Kristen here with us today, our Lift Up Lou initiative that's bringing music, art, exercise, learning, mindfulness, and hope to the people of our city through social media every day. We're getting to know each other, I think, a lot more as we go through this crisis. That's when you really learn about people and see, are they in it for everybody? And most everybody is. So as part of Lift Up Lou, we're announcing a small way to help out another group that's been really hit hard economically by the coronavirus outbreak, and that's our city's incredible artists. All of our cities, great theaters and galleries and performance spaces, they are shut down right now. And they've got to be dark and quiet out of necessity. But that does not mean our artists have to be silent. They have a lot to say all the time, especially I can't imagine the kind of creative juices that are flowing out of this COVID-19 world. So we need our artists as much as we've ever needed them. We need their voices, their creativity. We need their beautiful work to give us some comfort and inspire us as we go through here. And so that's why I'm really excited to announce the launch of the Louisville Arts Network. This is a new component of Lift Up Lou, and it's designed to bring together the creative, philanthropic, and public sector communities in an effort to heal and inspire and motivate and mobilize our city. So we're inviting Louisville artists from a variety of art forms to submit their ideas online at louisvilleartsnetwork.org for a project that can be completed in 3 days. And these approved projects will be displayed for the world to see on Lift Up Lou, and the projects will be highlighted every day at 3 p.m. on social media at Lift Up Lou. So representatives from 10 arts organizations have joined to assist with the selection of artists to receive these micro commissions, which are supported in part through donations from Owsley Brown III and Christina Lee Brown, two very generous community citizens. So thank you, Owsley, and thank you, Christy. I'm joined now by Teddy Abrams of the Louisville Orchestra, a tremendous citizen, a tremendous globally creative talent that we're just fortunate here to have as one of our friends and colleagues in the city. So Teddy helped us launch Lift Up Lou, and he's been instrumental in helping launch the Louisville Artists Network. So Eddie, come on, man. How you doing?
I'm doing pretty well here. And first of all, just a shout out as you've given to everybody that's fighting this thing on the front lines. and to tell you all that as a representative of the arts community here, and you're right, we have a very special and talented arts community, we are here to back up everyone, that we are here to do our part in fighting and winning this war against not only the virus itself, but the social isolation and the changes to society that we're all experiencing together. And one of the things that we wanted to do was take a look at how previous generations have fought crises, and taking inspiration from the New Deal and the WPA. We thought we could get a jump start on this and say that art and artists, culture defines us, and it helps us, it brings us together, but it doesn't do that unless we activate it. And so just like the New Deal and just like the way that artists contributed to getting ourselves out of the Great Depression, we're going to get a jump on this right now. The Louisville Arts Network is a concept where every single day we're going to release a new commissioned work. And that could be a piece of music, it could be a visual artwork, it could be a dance, it could be a poem, a story, anything that you could create that is considered artistic. And there's now a website, as you mentioned, LouisvilleArtsNetwork.org, where you can submit your ideas. We're going to turn these things around very quickly. Everybody will have 3 days to complete it. This is all about responding to the now. This is not about, your 10-year opera project. This is about creating stuff for us right here and now, because we need it right here and now. And I believe that we're going to harness the power of our creativity to create something that we're all going to be able to share in each day. And it's open to residents of Jefferson County. So this is really something made by us and for us. I don't think there's anything quite like it. And again, this is important, these are little commissions. We're not asking people to just do this for free, because artists are some of the hardest hit people, because they often are freelancers with already challenging financial circumstances. So there's a small honorarium, $150 to $200 involved, but we want these things to basically reflect your understanding of what's happening, to help us through it together, create something that inspires and elevates us all. And we're very excited about this new program. I think it's going to be a national model, in fact.
That's awesome. Well, and if people are listening that they're turned on by this, if they want to give to One Louisville and say, let's do more arts programming, we're happy to do that as well. We've got unlimited capacity in the city with both creativity and our artists. So, Teddy, thanks. This is an example right here, Teddy Abrams, of a good citizen. Okay, when this all started, he called and said, how can I help? And, Teddy's got a lot of gifts, but one of them is that he really takes seriously this role of being a citizen. So thank you for being an artist and applying that to uplifting our city. You and Margaret Brosco, Ted Smith, all the folks that are coming together around Lift Up Lou. So yeah, let's make some history with this. Let's make some legacy. I love the idea. You're gonna have an official commission every day.
Every day. This city is going to have a lot of art on its hands, but that for me is the way out, because it's going to be something that we can all own. It belongs to all of us. So everybody visit LouisvilleArtsNetwork.org. That website is live. And for artists, also take a look at ElevatorArts.org, because you can get additional grants from that network, which just went live over the weekend too. So I'm so proud of our community for coming together to support us. But now, artists, this is our call to action. We've got to do something to support our community. So let's go and really create the most inspiring, beautiful stuff that we can, because our people need it right now.
And Teddy, will you allow me from the mayor's office to proclaim the official commission of the day, as you all decided?
Yes.
Okay, so we will have an official proclamation every day with the commission as decided by this group here to make sure it's part of the city's history. So good job, team. All right.
Amazing. Thank you, Mayor. Thank you very much.
Great. Well, folks, we talked about earlier how it's Public Health Week, and I gave a shout out to Dr. Moyer and the team, Dr. Kaloya. So our Chief Health Strategist, Dr. Sarah Moyer, is with us today to give us an update on what we can do to improve the health of our city and how we get through this virus. Dr. Moyer.
Thanks, Mayor. So here today with your daily reminder that the virus doesn't move, people move, and the virus will stop moving when we stop moving. But we still need to go out for groceries, meds, and essential personnel need to go to work and home, and that's it. But want to start out today, just like you did, with a big shout out to all my public health employees. I have about a team of about 200 staff that work every day to ensure that we reach our vision of a healthy Louisville where everyone and every community thrives. Public health is really important today and every day. And just for information, preparedness is only about 3 of the 200 staff that we have. So we've had to hire firefighters after the fire started, in a sense that the rest of my team of 200 has really stepped up in order to combat this and be prepared for the city. And we've had the support of the entire Louisville Metro government helping us and getting behind and learning what it takes to be a public health employee. So really proud of my team and really proud of Louisville Metro government really helping make sure that we've got every angle covered and we are going to get through this. Today, I wanted to talk about a new CDC study that came out that shows that people with chronic medical conditions, no matter their age, are at a greater risk of serious disease and death from COVID-19, no matter their age. We've said 60 and older and those with underlying medical conditions are higher risk of disease and death. And as the mayor said, we are now up to 23 deaths, and our deaths reflect that. There are people with underlying health conditions. So the CDC report that was released last week showed that people of any age with underlying medical conditions are at increased risk if they contract COVID-19. They've analyzed over 7,000 confirmed cases and looked for things like heart and lung disease, diabetes, chronic renal disease, liver disease, immune-compromised conditions like cancer, and whether or not you were a former or current smoker. Of all the cases that they analyzed, they found that 10.9% of patients who were diagnosed with COVID had diabetes, 9.2% had lung disease, and 9% had cardiovascular disease. In this, they found that 78% of people admitted to an intensive care unit, that's the most intensive care that the hospital has, had at least one underlying medical condition. And 71% of people hospitalized but not needing the ICU also had at least one underlying health condition. Only about 27 people with no underlying conditions needed to be hospitalized. So in the US, we're seeing the highest rate of severe COVID among people who have diabetes, chronic lung disease, and chronic heart disease. And we know in Kentucky and in Louisville that we have high rates of these diseases, which is why we've implemented strategies like social distancing and hand washing to protect everybody, and especially those with underlying conditions. So please remember, the virus doesn't move, people move. So stop moving. We can overcome this pandemic. Got to stay home and allow our healthcare heroes, first responders, and other essential personnel to do their job safely. Everyone that catches COVID makes their job more difficult. Also, CDC is recommending cloth face masks now for the general public when they leave their house. This is to protect you from spreading the virus to others. Just in case you haven't shown any symptoms yet, it prevents you from getting others sick. Just really important point that I don't think is getting shared enough is you have to wash your hands before you put the mask on, and then you have to wash your hands preferably before you take it off. And when you take it off, you put it right into the laundry or garbage can if it's disposable. Because if you're touching your face and your hands are dirty, or if you get the inside of the mask dirty and put it back on your face, that's worse than no mask at all. So keep practicing social distancing, even with the mask on. We know we can all do this, but we need everybody to play their part, whether that's essential personnel showing up for work and caring for us despite all their fears, and everyone else that's staying home despite having cabin fever. So thank you, everyone, for doing your part. And back to you, Mayor.
Good. All right. Thanks, Dr. Moore, again, and thanks to you and your team. So we all know that the best way we can play our part in this, right? What is it? Stay home, stay home, stay home. But I also want to thank folks that have stepped up to another level and that have answered the call from the Red Cross by donating blood in the community. The Red Cross is a great partner, one of the great brands in the world. They're also one of the recipients of our grants that we just announced a few minutes ago from the One Louisville COVID-19 Response Fund. So we just really appreciate the work that they do. We've been talking about their need for blood here on these daily media briefings. And as we reported earlier, COVID-19 led to numerous blood drive cancellations, which could lead to a shortage of blood for our hospitals. But over the past couple of weeks, our friends at Red Cross say they have been able to meet immediate patient needs thanks to you all stepping up in the community. So that's some good work there. Now, we've also going to have another blood drive going on. So we need to make sure that we keep our supply going. So there's still some time slots available for this week's Red Cross Blood Drive, Wednesday and Thursday at the KFC Yum Center. So individuals can schedule an appointment at www.redcrossblood.org and enter sponsored keyword KFC Yum, KFCYUM. At the blood drive, they've got social distancing and other safeguards in place. And one of our rules is no walk-ins are going to be allowed. So donors must schedule an appointment in advance. So please go ahead and do that and join the folks who stepped up and rolled up their sleeves and helped us save some lives. And I want to thank the folks that have done that. I want to thank the Red Cross. I want to thank their volunteers, their staff, everybody that's really helping out and make sure we have blood so we can support our frontline healthcare professionals who are keeping us healthy and safe each and every day. So thank you. Get out and give some blood. All right, I'd like to end these sessions with a message of hope, and I take a lot of hope from the great announcements we've made today. Think about that. We talked about One Louisville Fund being over $8 billion. We talked about the Louisville Artists Network. We've talked about Red Cross. We talked about 15 new agencies getting money from One Louisville. So we are doing what it takes to sustain this community as we get through this crisis. And then there's this as well. We're seeing lots of fun images around the community. Of course, the rainbow, people walk around and say, hey, Mom, I saw a rainbow in that window. Or, hey, Grandpa, I saw one there. Or I saw it on the sidewalk. So this is kind of a fun way to keep us all connected with our neighbors. So distance will bring us together. That's right. So lots of fun. So and when you're outside, kids there, use some chalk and leave some messages. Times are tough, but so are you. That's right. I saw one the other day. It said, don't be mean, quarantine, protect your grandparents. So put your art out on the sidewalk or make a sign and bring us all together. One of the ways we're coming together is through Lift Up Lou. That's got kind of a daily rhythm to it now. So if you're at home, you might have that new rhythm going. JCPS started back today with their online learning. So that's a new part of the rhythm we have to integrate into our lives. But one area that people are tuning into is every night at 7:00 on Lift Up Lou. There's an online mindfulness session every night at Lift Up Lou. And tonight is a moment of mindfulness and compassion from the Passionist Earth and Spirit Center. Father Joe Mitchell and his team there, they're good folks. We could all use more mindfulness and meditation and breathing exercises. It makes everything feel better. It's good for your brain, especially good for brain development in kids. So that's at 7:00 tonight. Just follow at Lift Up Lou on social media and tune in. Okay, one last reminder to everybody, please fill out your 2020 census forms so we can all be counted. The more we're counted, the more money that flows our way from the federal government. So it's really critical to the future of our city. And if you haven't completed your census form yet, please go to my2020census.gov, my2020census.gov. One last announcement. We've got a series of Facebook town hall conversations happening over these next few days. Tomorrow at 10 a.m., we'll have another Facebook teletown hall. The doctor is in. I'll be joined by Dr. John Klein and Dr. Mona Lisa Taylor. We'll take your questions, health questions about COVID-19 from these medical experts. These are always highly watched programs, so look forward to that. And then on Wednesday morning at 10, we're going to talk about the response of our local faith community to COVID-19. This is a very religious week for Christian tradition, Jewish tradition in our country, around the world. So our guests will include leaders representing the Catholic faith, other Christian faiths, Muslim faith, and our Jewish faiths as well. So that will be interesting to talk about the spiritual aspects that we're going through here through this COVID-19 virus, and as we're here in the Christian Holy Week. All right, so town halls tomorrow and Wednesday morning at 10:00 here on Facebook. All right, so with that, we'll go and take some questions. Dr. Moore, we got a couple questions from you for the media, so reminder to send those questions in if you'd like for us to answer them. So Wave 3 News is asking, are we to the point where we can look at the data of positive cases to identify particular zip codes or neighborhoods in Louisville seeing a particularly higher rate of cases than other areas? And does that play a role at this point in contact tracing and containment?
We are working on that. Right now, we have the number of cases plotted on a map for internal use. We're working on the rate number to make it more accurate for the public, and hopefully we'll be able to share that soon. Doesn't make a doesn't change contact tracing. Was that the second half of the question?
Yes. Mm-hmm.
So right now, we're assuming everybody you meet in public is positive, and so that's why we're recommending that staying the 6 feet away. Contact tracing and more individual investigations will begin after we hit our apex and the curve is starting to go back down in order to keep people that we know are positive away from others. It's also just difficult to, I'll end there.
Mm-hmm. Let's take this next question together. Indiana's health commissioner just said this afternoon she would not oppose a small number of family members gathering for Easter. Do we agree or disagree with that?
I think from a medical standpoint, every person, new person you come in contact, you're also coming in contact with everyone they've come in contact with, and everyone they've come in contact with, I mean, it exponentially goes up. So if you're willing to take that risk, then I guess that's okay. But if you know anybody who has a chronic medical condition, I would not extend it beyond who you're already with in your own house.
Right. So think of this as like a bubble, right? So like who's in your bubble? It's the people in your house. And so anytime you're exposing yourself to anybody outside of that bubble, the risk goes up. So imagine now if people said that and says, oh, okay, well, I can go see my family. We will have literally hundreds of thousands of people moving around our community that'll be potential carriers of the virus. So I would say, sadly, with a heavy heart, you should not do that. Okay, this is why we're trying to tell people to stay home and avoid close contact with folks. So think about how you can get together on a Facebook chat, on Zoom or WebEx, whatever it might be, and have that be this, the Easter season or Passover season of 2020. You gathered virtually online. So just the less we get together like this, the sooner we're going to be over the virus. So there's really no special exemptions to the virus. It doesn't care about who you are, where you live, why you're getting together. It's going to travel more. We're doing a good job right now, folks. So let's keep doing that. I know it's going to be hard during this Holy Week, but it's more important than ever. So that would be my opinion on that.
Yeah, every day that we can delay getting sick gives us hope that we have the medical treatment to treat us. So really recommend not extending that bubble, like the mayor mentioned.
Yeah, and I just want you to personalize it, right? I mean, this could be somebody that you know, right? Everybody knows somebody in the vulnerable population, pre-existing condition or somebody over 60. And I would hate for you to be the person to give them that virus and then for you to see them laying in the hospital. You wouldn't see them in the hospital, but you would just heard that they passed. And so you don't want to do that. Okay, we got a question here on, it says, the grocery stores and parking lots are packed every day. Can't we insist on curbside pickup like the restaurants? I think people are going to the grocery somewhat because it's the only place open and they are bored. Okay, so we do know that the Courier just posted a story saying the company announced Monday that it would start, this is Kroger, that it would start limiting customers to 50% of storage capacity on Tuesday to better encourage social distancing. There are at least 20 Kroger locations in Louisville as well as 2 across the river in southern Indiana. So the new rule means for every 120 square feet, only one customer will be allowed inside Kroger stores. So good job to Kroger for doing that. But yeah, you can obviously order your groceries in advance. We'd encourage that as well to limit the exposure that people have. Okay, we have a question. Why is non-infrastructure construction still going on? We're saying for construction, if you can stay socially distant, you can still be doing your construction projects. The ones that we have seen are practicing that in the community. If we see construction projects that are not, we will move to shut them down. How's my wife doing? Alex is my wife, Dr. Alex Gerasimedes. She got her test results back after she came out of isolation on day 13, and she is COVID-19 negative on the test. So we're very grateful for that. She's back in action and very grateful. This virus can be tough, and it was a tough transition period for my wife there. So I appreciate everybody's thoughts and prayers as she got through this. Let's see. Mayor or Dr. Moyer, you both comment on the city's new order signed today cracking down on pop-up scam test sites. Do we expect to see more of them in the coming weeks, or is the hope that this order will further help prevent them from popping up again in the Louisville area?
I can go first. So we're hoping that this order will prevent any new ones from coming. And if they do, they're going to be required to work with the health department just so we can make sure it's legitimate and safe and they're not spreading COVID instead of just testing for it. I mean, increasing testing is one of our priorities, and we're looking at ways to do that safely. But outside labs coming in doing it on their own is not the best.
Yeah, any folks that we think are scams, we're running them out of town. That's what we did last week with the 3 that were here, and we'll continue to do so. So we're hoping the word gets out that you're wasting your time if you're not legit, if you come to Louisville. So we'll keep up that level of surveillance on them. Okay, Laura Ellis is asking, where are inmates in isolation being kept? We have isolation cells, not surprisingly, at the jail. So they're being kept there while they're being assessed to determine whether or not they have COVID-19 and are a threat to the population. So they're have their own isolation quarantine areas so that they are not mixing in with the general population. Will the city's ordinance prohibiting wearing masks in public places be enforced against those wearing masks to protect against coronavirus? We're looking for Jefferson County Attorney's Office clarification on that, but the ban that we have on masks right now really largely relates to almost full covering the whole face. So, what the masks we're talking about are basically from the nose down, right? So we'll be able to distinguish between those two. And then Marcus Green, hello Marcus, a good reporter. Is there an update on the current number of ICU beds at the city hospitals? What percentage of those are currently occupied, of the total number occupied, and what percentage of those are now filled with COVID-19 patients? Marcus, I do not have the numbers in front of me on that, but I can tell you there's adequate capacity, and it's been relatively stable over the last, what would you say, Sarah, the last 7 to 10 days or so?
Yeah, it's since they stopped doing essential procedures, the number of hospital beds has increased and it's been steady so far.
And then Darcy Costello asked, is the city considering finding hotel or dorm or other beds for first responders who worry about infecting their families if they return home after work? And if so, what's the status? So yes, Darcy, we are. We've had those conversations. We're checking with our workforce to see what kind of interest there would be in that. And we've contacted a few potential locations to see what type of situation we could arrange with them. So that's something that we're very concerned about. Obviously, our first responders staying healthy, and our first responders are very concerned about them not taking a virus home as well. Families are concerned about not passing the virus to their first responders. So one way to do that will be able to get them their own room that they can stay in when they're not working. So we're doing that. Okay. Okay, now just a clarification back here on masks from Gene Porter. Yes, it is correct that the current law right now is for masks that covered the whole face. So we're fine with face coverings that we're talking about here with coronavirus. Okay. All right, folks, that's the questions for the day. So thanks for joining in, and thanks for the good work everybody's doing to get the message out, practice social distancing. Thanks for our arts community, our nonprofit community. Everybody in our city is really pulling together to do a great job on this. So very grateful, very proud of our city. All right, go Louisville. See y'all tomorrow.